Concern tonight as more hospital beds around Connecticut fill up and the holidays are here. Keeping hospitals from being inundated will be much harder than it was in the spring because the second COVID wave is hitting everywhere. News 8's Lisa Carberg has more from Yale and Hartford HealthCare systems.
Yale health leaders have a big concern that should their medical staff become sick, no backups from other healthcare systems will be available.
The pandemic is so virulent in so many parts of the country that nobody is loaning out staff. They don't have nurses and PAs and others to send to any of the many hotspot areas.
Yale New Haven's ICU is now 80% full as numbers rise daily heading into December. They are seeing some differences from the spring. The number of COVID patients now compares to what they treated at the end of March, but the severity does not.
The number of patients that are on ventilators is slightly less, and that really represents improvement in knowledge by our critical care physicians, where we are using more high-flow oxygen and less intubation than we have in the past.
Dr. Balsasak says that combined with things like steroids and turning patients over have helped.
Has resulted in a lower mortality rate, pretty substantially lower mortality rate, numbers that we've shared in previous news conferences.
But he says this is no time to let our guard down. Hartford HealthCare's Chief Clinical Intregration Officer says while COVID-19 testing may be popular, it will not keep you completely safe.
Tests can be helpful, but it certainly does not mean that you're not capable of spreading this virus. So all the precautions that need to be taken as we move into the holidays are critical for us to control this.
Dr. Cardon says keeping our hospitals from being inundated is the personal responsibility we all have to keep each other safe and to be thoughtful. Lisa Carberg.